my name is Mel Whaley with Tennessee Advocacy Talk, and today we're going to talk about patient brokering. And some people may have not have heard what patient brokering is, and so it's a big thing going on right now that is really affecting the way people get care and receive care, and plus a domino effect in the whole system of care. And so today I have David Cunningham with me today, and he's actually an expert in this industry, and we're just going to pick his brain a little bit. And for your topic about patient brokering, what can you tell the people exactly what it is for those that are not sure what patient brokering is?
Well, it's very heartbreaking to me in this industry to see what's been going on. It's been happening for a long time. I've been warning people in Tennessee that it would be here at some point, and sure enough, it has been. And basically it's selling someone to another treatment center. Somewhat of a whole new level of human trafficking, but people are making lots of money doing this.
So when you say selling, so can you go in a little bit about what the selling means of people?
They probably have so many tactics that I'm not even aware of. One is a big red flag, or several red flags, is if someone says, we will fly you there and we're going to scholarship you. Have some caution at that point. But if I were a patient broker and you called me with a loved one and you said, well, we have no money or insurance, I'm likely to go, no problem. We'll fly them there and we will scholarship them. They're not scholarshiping them, they're buying them an insurance policy, bilking the insurance for every penny possible, and often kicking them to the curb or assisting them, if you will, in a relapse so they can get them back in and bill the insurance for even more money again.
So basically when someone has a substance abuse addiction and they are needing treatment, maybe because they've overdosed or they're just really struggling, whether it's opioids or any other type of substance abuse or alcohol addiction possibly, what you're saying, these people that are brokering actually seek these people out and create these types of contracts to get them placed at facilities.
Yes.
And they get paid, right?
Yes.
And how much payment are these brokers awarded for doing that?
The least I've heard is $250. That's usually some of the lower end. I've heard up to $9,000. $5,000 being a common number that I hear pretty often.
Wow. So averagely $5,000 that these people are basically being brokered for to go into treatment facilities.
Right, being sold. After they've already experienced a tremendous amount of trauma at others' hands or at the hand of their addiction, then they're traumatized again by being sold.
Now, is this just a one-time occurrence, or can the same person be sold like a few times?
Many times. I encourage people to look at Huffington Post. If you'll Google Huffington Post and patient brokering, you'll Google New York Times and patient brokering, YouTube and patient brokering, you'll find a lot of heartbreaking stories. You'll also hear some former patient brokers kind of telling what happened, but they're going into support group meetings. They'll send them anywhere.
So where are the type of places that these brokers go and look for people?
Well, I mean, they'll go to the street and offer them what has been called a detox package. Someone that is in the throes of addiction, and they go, okay, we will get you high, and then we will get you in a detox.
Wait, they actually get them high?
Yes.
So they can get them in the detox?
Yes, yes. They will pay active addicts and buy their heroin at times to go have someone relapse so they can get them back in treatment.
And how long has this been going on? I mean, this can't be the first time we're hearing about this.
No.
Like, how did this get evolved, I guess?
Well, when I first got in the industry, I remember someone that was investigated and actually did some prison time for this exact same thing. Now they've figured out a criminal niche for this, I believe. It's safe to say that where people are making lots and lots of money and hiring, and they're making a lot of money. There's just, I mean, they're bilking the insurance for services that are not rendered, whether it's individual session, group session. The drug screening is a whole nother issue. They'll drug screen them sometime and do split specimens every 48 hours and bill the insurance $1,200 a pop for those. I read on one post a guy that had came back from treatment had over $200,000 in urinalysis, and he had been in treatment for 30 days.
Oh my gosh.
And more people starting to do it.
Okay.
And then when they get someone to do it with them, then they break off and do it themselves. They'll hire people in sober houses to go to support group meetings, soliciting, trying to get people into treatment.
So it's extremely organized then.
Yeah, I guess it would be. Arizona, Florida, Tennessee, that I know of, have implemented these new laws. But people are being placed inappropriately. And they're being placed by, most of the time, people that are either barely sober or have no credentials or both.
So so these brokers, what you're saying is really don't have the background to conduct psychosocials or assessments to match them to treatment facilities. Yeah, it's really complicated because I do know like even medical conditions can fall into where somebody gets placed. So for somebody to be able to traffic patients like that or broker patients like that, even not even concerning about their particular medical conditions as well, you know, that's definitely negligent.
In Florida, also the patient brokers, the facilities, but the sober homes. They've went after the sober homes hot and heavy. Correct.
So for people that are, in the situation now to where they think their loved one might have been brokered, what do they do?
Seek out someone that's been in the profession, that would treat their family like they would want their own family treated. My cell phone's always been available ever since I've been in this profession, and since we had cell phones. I'm always open to talk to families. Doesn't cost anything to talk, and there's a lot of good people around. Unfortunately, it's been an ongoing problem that I believe we're starting to get a little outnumbered, becoming a little bit of the minority, because I kind of equate it to anytime there's a natural disaster, hurricanes, floods, anything like that, you've got all the scammers coming in. Now with the opiate epidemic, people are flooding in, setting up sober homes, doing this patient brokering stuff, and trying to milk it for everything they can.
Yeah, so sad. Now, you go around doing trainings and presentations to educate even recovery centers and people in the industry about this topic so they can possibly be aware of the signals, correct?
Yes.
Okay.
And when some friends of mine first did one in Boston, that really kind of set up my radar on this, because some well-seasoned therapists have been doing mental health and substance abuse treatment for years. And when they asked who knew about patient brokering, there was maybe one hand in the entire crowd went up. So I knew right then, if seasoned therapists weren't aware of it, law enforcement wasn't aware of it, district attorneys weren't aware of it, that the general public and the consumer of treatment services did not have a clue.
criminal act that people are committing, but you got to think if they are making these fraudulent claims to insurances. I mean, think $30 million of fraudulent claims, that can really screw up the law of large numbers and how insurances adjust their rates. And so it's actually a domino effect again in the whole industry. So David, if somebody wants to get a hold of you to find out more or to maybe have you do a presentation, how can they get a hold of you?
865-661-2818. That's the best way to get me. Text or phone call. I'm happy to do those anytime within reason. I will fly to places if need be.
Okay, wonderful. And is there anything else that you would like to talk about or advocate for before we leave?
Well, it's just the importance of getting people to the right place. Whether it's adolescent with mental health or substance abuse or adult, there's a good placement for each of these people. Taking very meticulous steps and finding out where is the best place for these folks. Avoiding the internet. The internet is so deceptive. So many of these people have said, oh, my family sent me there, we flew there for free, and it was nothing like that was on the website. And there's a lot of deceptive practices on the website in every arena. This one's not immune to that.
Okay, yeah, and that's exactly why I wanted to advocate about this topic, is because people are really being stranded. Average cost of $5,000 per patient, which is crazy. And so thank you, David, for talking about this today. And this is definitely a developing topic, and I'm sure we'll have another follow-up to see where we're at here in the next 6 months or so, especially to see how this bill in Tennessee that was set July 1st of 2018 really does what it's supposed to do. So thank you so much, David.
Thank you.
Thank you. And you can find us on tenntalk.org, TENNTALK.org. Thank you. Bye-bye.